We're now just months away from recreational pot being legal in this country, but cannabis for medical use has been allowed for a while now, and soon, depending on your provider anyways, the cost could be covered by your health insurance plan. Sun Life is the first major insurance company to add medical cannabis to its group benefits plan for Canadian companies. As of March 1st, Sun Life will include optional coverage under an extended healthcare benefit plan. Individual companies will be able to request the added coverage for employees. They can also choose a yearly benefit amount ranging from $1,500 to $6,000 a person. The move potentially affects a lot of Canadians. Sun Life administers group benefits for more than 22,000 companies in this country and provides coverage for more than 5 million Canadians. Here to talk about the future of medical uses of cannabis and the medical evidence needed to back it is Dr. Mark A. Ware. He is Associate Professor in the Departments of Family Medicine and Anesthesia at McGill University. He is also Executive Director of the Canadian Consortium for the Investigation of Cannabinoids. He joins us now from Montreal. Mark, how prevalent do you expect a move like this to be, where we have insurance companies picking up cannabis as a coverage benefit for people that are covered under them?
Well, I think we're seeing this as a bit of a trend. It started with a number of companies, including under their own benefit plans, coverage for patients using cannabis for medical purposes. I think this is the largest such move that we've seen so far, but it appears to be part of a trend towards an increasing recognition that for a number of patients, cannabis is one of the therapies that they're using to help them.
I think a lot of Canadians, a lot of people who use cannabis as medicine would say, why on earth did it take so long?
Well, I think for that, you have to sort of recognize that this is coming out of a perspective that cannabis for a long time has been considered a drug of harm, a drug of abuse. And so it's been very challenging to get people taking cannabis for therapeutic purposes very seriously. I think there's also been a challenge that getting data to support these uses, clinical trials are expensive, they take a long time, and I think the evidence has been slow to emerge to support these decisions.
The other thing that sort of comes out of this is at its inception, I mean, we all know somebody who went to a doctor and got a prescription because they had glaucoma, whether they had it or not. And it was part of the movement to try to liberalize the laws around cannabis and around marijuana use in this country. Will we see inevitably a tightening, especially now that we're into recreational marijuana is about to be legal and we're seeing it more from a corporate standpoint? Do you imagine we will see a tightening in how we are prescribing this kind of medication?
I think what we'll see over time is a general sort of separation of people who choose to use cannabis as a recreational substance, a non-medical drug, and those who continue, and many of them do want to be seen as using this therapeutically and will want to speak to their healthcare professional, want to use this as part of a treatment approach to managing what can be very chronic and very debilitating symptoms. So I think with the advent of a legal non-medical framework, we'll begin to see some separation between predominantly non-medical use and those who do wish to use it medically. I think what's really important is that there be some mechanism for those patients to have access to their physicians, to be able to speak about this as a therapy and to be taken seriously when they do so.
And is literacy among doctors, physicians in this country, family doctors, whatever it may be, is literacy around marijuana, around cannabinoids in general? We're not just talking about smokables. We're talking about, the way we eat it, the way we consume it in all different kinds of ways. Is there a literacy issue that still needs to be addressed?
I think there's generally no question that doctors in Canada specifically, but widely, most health professionals are really not well informed about what cannabis is, about the cannabinoids that are contained within it, about the safety and efficacy around the use of these products. So generally speaking, there's a huge deficiency of knowledge in the healthcare system about how cannabis is being used. And this extends and will extend in the future when cannabis is going to be legal for non-medical purposes. Health professionals are still going to need to talk to people now, parents, other patients, other members of their practice about cannabis use for a range of different reasons, medical or otherwise.
And I mean, I've talked to people in the past about this, that one of the biggest hurdles that I was told to getting proper clinical studies done and real data on how this works was on a placebo effect. Once we're into edibles and drinkables and whatever it may be, can we avoid that and get better and more data? Or is that still the placebo issue? Is that still a big problem here?
The placebo issue is a huge problem in every clinical trial for a lot of chronic illnesses. It's not specific to cannabis. It's a challenge that a lot of people. The placebo effect is remarkably powerful. Separating out the true effects of a drug from the very powerful placebo effects that come from using any medication and the expectancies that go along with taking something for your condition can be very challenging. And this is why it requires large studies and very well-designed studies. I don't think that's necessarily a major barrier. I think issues around funding, around supply of well-defined, good quality cannabis products for clinical trials have also been significant barriers.
All right, Doctor, we have to leave it there, but thank you so much for making the time today.
No problem. Thanks for having me on.
That was Dr. Mark Ware. He's Associate Professor in the Department of Family Medicine and Anesthesia at McGill University. He's also Executive Director of the Canadian Consortium for the Investigation of Cannabinoids. Coming up, the Dow may have broken through 25,000 points again, but last week's jitters still linger. We'll talk to one young financial institution to find out how they're preparing for a potential downturn. That's coming up. But first, another green day for North American stock markets today.